Close to 2 million people in Michigan have a mental health condition. 1 in 5 adults and 1 in 6 children have experienced a need for mental health care. But a new report from Inseparable, a health advocacy organization, shows the mental health workforce is in a crisis. News 10's Bobby Cushing joins us live in studio with more on what this report says. Bobby.
Yeah, good evening, Taylor. This report finds that Michigan is meeting only about 40% of its mental health workforce needs, citing high educational costs and low pay. As a result, patients who are in need of care can struggle to find resources quickly and in some cases struggle to find it at all. For years, health experts have spoke out about a need for more mental health workers. And now a new study from Inseparable, a national health advocacy organization, illustrates what the barriers are that have kept the workforce from growing.
So there's financial barriers, there's licensure and credentialing. It takes time and a lot of education to become a licensed professional. And then once you enter the field too, you're dealing with insurance barriers as well as low reimbursement rates. So that's
Caitlin Hochul, Senior Vice President of Policymaker Relations at Inseparable, says less than 40% of the need for mental health workers is met in Michigan. And patients report going out of network for care nearly twice as often than for medical or surgical care.
Having to wait weeks or months to find a provider or be told that there's no one available in their state to be able to meet their needs. So their conditions get worse. They may experience a mental health crisis.
She says this issue has been highlighted even more recently due to the rise in the amount of people who are seeking mental health care.
Over the last few years, there's been a significant increase in demand for mental health care. So there's higher rates of mental health conditions. There's more people than ever before seeking care.
But access to care is expanding in mid-Michigan. Last month, leaders from the University of Michigan Health Sparrow announced a new behavioral health hospital coming to Lansing. Margaret Diamond, the regional president, says it's aimed at addressing a sweeping need within the Lansing community.
If you look at behavioral health, mental health resources will be added that we previously didn't have.
Hochul says one potential solution to get more workers in the field is to offer stipends or scholarships to help reduce the overall cost of the education these professionals have to take on. Taylor?
Thanks, Bobby. The National Center for Health Workforce Analysis projects there will be a shortage of close to 100,000 mental health counselors in the country by 2038.